It's frightening to know that with the health issues in my family that anything, could happen, and a lot has cropped up in my own personal health.
The fact that women and men often can present differently and the age delay in the onset of cardiovascular disease in women leads a physician to possibly have a bias.
So I went back to my doctor and I just told him, I said, something is not right. They just didn't see what I was trying to say. When I say I'm running out of steam, they was like, maybe you're not sleeping well. Maybe you need a sleep aid. No, I didn't need a sleep aid.
One of the real challenges we have is that most of the evidence that we've generated has been in men. And the assumption has been that treating men has been the same as treating women forever.
And so the purpose of knowing what was wrong with me was so that I could see my grandchildren grow up, so I could see my great-grandchildren grow up, so I could see.
We unfortunately have had a gaping hole in the evidence on which we could base that personalized medicine, because we haven't studied women and girls to know what their outcomes would be. A huge goal of the center is to be able to generate the critical data in order to make great decisions for men and women, and boys and girls.
The power of community is one-on-one. One person can touch one person, and if you make that circle, it will be unbroken.
The Center for Women's Health Research has a three-part mission. The first is to do cutting-edge research in women's health and sex differences. The second is to mentor the next generation of MD and PhD scientists to study women's health and sex differences. And the third is to educate the public and their healthcare providers so that everyone knows about the best possible care they should receive.
I love the idea that as researchers, we are bringing an idea to life, that we have the concept, a question that we want to ask, and then we work together as a team to develop that question, to ask the right angles on it, to make sure we're controlling for the proper variables. And as it grows, it thrives and it can actually impact people.
We are passionate researchers doing exciting work together as a group in order to impact lives.
We have our center, and we make the link with the community to get people like Sherry out there know what messages they need to bring to women, to families, to men. It can spread like wildfire.
I want to thank the Center for Women's Health Research, because had it not been for the series that they do, I could have went on saying Granny's just running out of steam. I could have went on asking my doctor, well, what do you think this might be? But when I attended that series of Matters of the Heart, I knew what it was, and I wasn't going to take no for an answer. So I thank them for all the work that they do. And I would just be prayerful that they can achieve everything that they set out to do.
There's still a lot to be done, and supporting research is supporting better health.